Are we ready for protein-specific allergen diagnosis in clinical practice? I'm very grateful to the NIH for support and continuing support. I'm grateful for Fadio and Thermo Fisher. And actually, as of yesterday, I have a patent on using CAP to diagnose IgE to recombinant molecules and the risk of anaphylaxis. I don't know why I have this patent, but I do. Let me start with peanut, because we've heard a lot about peanut, and I want to show you a little bit of the different issues. You've heard, here is a peanut assay. That's the F13 that you all do. And you can get a CAP or a specific allergen diagnosis for RH1, RH2, or RH8. You can get, and those are available currently. And you can do the specific allergen, or you can use Isaac. And this is data from the Viva cohort in Boston, and I'm grateful for Bob Hamilton, who did the Isaac work on this. And remember, this is a chip with relatively small quantities of allergen on the thing. But what I want to show you is something that actually appeared in what Hugh said earlier, but he didn't point it out. That here is the peanut, all right? And this one here is effectively negative for RH1, RH2, and this number, 241 to RH8. That is that the assay for one of the components is much higher than the assay for the whole thing, because RH8 is only a minor component of the extract, all right? But if you look at this number, 27.5, you wouldn't think you needed to dilute it. All these ones here came through as greater than 100 and were then diluted to get the correct answer. And this is something we'll come back to. And you'll see this pattern here that you can see clearly on Isaac. Negative across here, and a very strongly BET-V1 and ARA-H8, and this is primary sensitization to birch pollen. And that you're all getting used to, I hope. I then want to talk about my favorite, and this is my actual all-time favorite patient. He presented as a teenager to Little Rock in Arkansas, where some allergist who's currently something to do with our society was then the head, and challenged him with pork, because that's what he said he was reacting to. 3 hours later, the challenge was stopped, because 3 hours is the routine time for an oral challenge. He went home and broke out in hives at home and was told that it was unlikely to be due to allergy. He then went to Denver to National Jewish, where Dan Atkins gave him a graded challenge, and he became sick and went into hospital. That is where we all were at that time. That is, we could not conceive of the concept of someone who ate beef or pork and did nothing for 4 hours and then broke out in hives and could have anaphylaxis. But this is IgE2. We eventually got in touch with Dan Atkins, got us in touch with him, and he has this, 16 units of IgE to galactose, alpha-1,3 galactose, that's alpha-gal, and 14 to beef. His mother was actually 23 to alpha-gal and only 3 to beef. There is a difference in these relationships, and we'll come back to that. But what I'm actually floating today is that we should call this midnight anaphylaxis. We've thought of late night anaphylaxis, but we like midnight, it sounds more seedy. And this is a lot of work by Scott Commins in our group. Okay, so let's get into CAT. On February the 4th, we genuinely saw 3 cases, each one of whom had a CAT-positive IgE assay and a CAT-positive skin test. And actually, because Hugh Sampson keeps saying we shouldn't do intradermals, we do intradermals the whole time. And for alpha-gal, you have to do intradermals. If you've ever tried to persuade an adult male to stop eating hamburgers because of a 2 or 3 millimeter wheel to a prick test, you're entitled to your own choice, but I've never succeeded. You do intradermals, you can convince them. Right, the first case reported eating pork sausage and getting a worsening of his breathing, which became severe enough that he went into a doc-in-a-box and actually got adrenaline. And he actually panicked because he didn't remember doing this before. And his skin test showed cat 6 millimeters, pork 7 millimeters, and beef negative. He'd actually been seen by an allergist and told that this had to be alpha-gal, and he asked to do a blood test and was told it's not necessary. But he was watching our blog site and he knew there was something wrong. So we did blood tests on him, and what you find is this, that he's got a total IgE of 40, not very high, cat dander of 4.73, and cat albumin of 4.95. And he is actually trivially sensitive to FeLD1. His beef is negative, and that pattern, and his alpha-gal is negative. So that he is actually a syndrome called pork-cat syndrome, here, which we have a letter in the Journal of Allergy, Scott Commins and Jonathan Posthumus and Haley and others who have worked on the syndrome. We've got 8 cases, each one of whom was sent to us as alpha-gal, and it turns out that in Europe, Hilger et al. And Drouet, Dr. Drouet in Paris has been reporting this syndrome for years, but as you know, we Caucasians over this side of the Atlantic are uniformly rude about French people, and we tend to dismiss it. But Drouet's got a lovely case of the hunter who went out and shot a boar, and then he ate the boar and died of anaphylaxis. Good for the boar. So we've now got actually 10 cases, and 2 of them report increasing asthma. We've never heard that, at least I don't think we've heard it in any of the alpha-gal patients. The alpha-gal patients are all reporting hives, itching, and sometimes anaphylaxis. About half of them just get hives and half of them get anaphylaxis. Right, what I want to show you is absorption studies on the IgE to cat albumin in one of these cases. So IgE to cat albumin is 24, and if you absorb it with a control bead, that's what you get. Absorb it with human serum albumin, you don't reduce it. Absorb it with cat serum albumin, you can remove all of it and the IgE to pork and the IgE to pork albumin. It's a cross-reactivity of the porks. And I don't know about mouse albumin, about whether there's cross-reactivity, but I don't recommend eating a lot of mice at a time. But what you see is that if you absorb with pork albumin, you really don't make a significant impact on the cat albumin, but you do on dog. And we use this kind of argument for saying that the primary sensitization is to cat. These are patients who are exposed to cat, become allergic to the albumin instead of the pork, instead of the FeLD1, and present with this very unusual syndrome. The second case was really a nice young man. He had a very clear history of reacting with hives 6 hours after eating beef or pork, but not chicken or turkey. And we get histories like this which are really beautiful. That is, that they actually say, yeah, beef, pork, and I reacted to lamb, but I do not get reactions to chicken, turkey, or fish. And I don't remember patients coming in with food allergy histories as clean as this, but they do. And his skin tests, as I said, cat positive. These are all intradermals, beef 10 millimeters, pork 10 millimeters, and that's much more typical of what we see with alpha-gal, chicken, turkey, fish, all negative. Right, so his blood tests showed greater than 100 to alpha-gal. His total IgE is 1,000, and here are the beef and pork. If you see greater than 100, you know you've got to dilute it if you want an accurate answer. And so here's what happens if you dilute the IgE to alpha-gal. You dilute it out Twofold, it's still greater than 100. Here's the blue dots. Fourfold, still greater than 100. Here, getting down to 100, and here we get a value. And the calculated value is over 700. That is over 70% of all his IgE is IgE to alpha-gal. We've actually done absorption studies to confirm that. But here's the problem. We dilute out the pork, and the pork does not dilute either. It goes down later. And the calculated value for pork is 552. But remember, the undiluted value was not greater than 100, so you wouldn't get a warning that you needed to dilute it, just as the same with the peanut previously. These are the oligosaccharides. Just to remind you that this is alpha-gal, the yellow one up here, which is very similar, is actually a blood group substance of the mammals, similar to blood group B, but without the fucose. And this is galactose-galactose-glicnac. Quite different from the plant-derived cross-reactive carbohydrate determinants, so we don't think there's any cross-reactivity between alpha-gal and any of the plant antigens that we know about. And just to remind you, this is the tick, this is my leg, this is seed tick bites, and that was accidental, but this summer, next week, I'm going to start getting ticks to bite me so that we can look at the histology of the ticks reactions. Don't tell the IRB. I'm not ready to tell them about it yet. This is a deer. Remember that this tick is a true deer tick. The Ixodes scapularis, which causes Lyme disease, is actually a mouse tick and not a deer tick. It grows primarily on mice. This deer is the thing that has really led to an increase in this disease. And this tick is now, the tick has been reported fully. Oh yeah, look at this. 200, 350, 532. That's my total IgE going up in parallel with the IgE response. This IgE response makes a major contribution to the total IgE. So here's a version of Der Spiegel in December with two truly horrific images. It's a, oh, sorry. It could have been George Bush, couldn't it? Anyway, this is an art, just to remind us that this tick-related IgE to alpha-gal is being reported in many countries now: Australia, France, Germany, Sweden, Spain, Japan. We have far more than they do. And this is not the correct tick. This is Amblyomma americanum, the Lone Star tick. The tick in Europe is Ixodes ricinus, and in Australia is Ixodes holocyclus, so that it's a bit different. So if we go back to our three cases, the first one is a pork is become sensitized to FeLD2, we think by exposure to cat epithelium, and presents with the pork-cat syndrome. The second one, sensitized by tick bites, gets rise to IgE to alpha-gal, which is on cat IgA, and Hans Gronlund and Marianne van Hager in Stockholm actually reported this first, that there was an oligosaccharide epitope on cat IgA, but there are many other proteins that are glycosylated with alpha-gal, many other mammalian proteins. And this presents with delayed or midnight anaphylaxis and not with wheezing. This may be related to wheezing as well. FeLD1, the third case, who actually presented with wheezing to the clinic, and he was wheezing more because of two things. One, he was living in a house with two cats, and secondly, because Primatene Mist came off the market and he could no longer get hold of Primatene Mist, and so he had no treatment. He had a 38% improvement in his FEV1 after treating with albuterol. So here is a case of IgE to FeLD1 in living with a house with a cat, and this is straight inhalant allergy, and that is the dominant association of cat allergy and asthma. Okay, and it cross-reacts with lions, and you understand that if you're allergic to cats and you get bitten by a lion, you can die of anaphylaxis, but you have to do it very fast. Right. Now I want to talk about a much more difficult problem, which is eosinophilic esophagitis. And can component analysis help us in eosinophilic esophagitis? First of all, I want to show you, this is Elizabeth Irwin's work from Columbus in Ohio. And she's already reported that many of the children with EOE have positive serum assays for wheat and milk and soy, but are negative by prick test. And I just want to show you, this is the kind of titers we see, and this is the peanut titers. This is Scott Cummins' peanut allergic patients in Charlottesville. These are children, and this is adults with alpha-gal, showing the kind of titers that we've been talking about. So the question is, what is this? And can this be helped with component assays? What we knew three things. First of all, many of these patients have negative skin tests. Very few of them report symptoms on eating wheat or milk. That is, the histories don't tell you what the answer is. And the titers are low in the serum. So the question is, was this IgE to a minor component? Is that what we're looking at? And remember, this is ARA. This is the peanut example. And ARA-H8 is a small component. And we know that. The company who makes these assays measures the quantities. They know that ARA-H8, if they increased ARA-H8 so that it was a large quantity, this would become an assay for birch pollen, which is not the object. It's a peanut assay. Here is cow's milk, and there are some very minor components. When we do ISAC, or again, Bob Hamilton did ISAC on this population of eosinophilic esophagitis patients, we find no components for wheat and no components for milk. As we've got a positive IgE assay, but we're not identifying. And I believe that's a very useful finding, because I think it means we need to look and try and find out what the component is. Let me just show you this calculation thing again. Get an observed result of 6.81. If you diluted it twofold, that should fall to 3.4, 1.7, 0.85. That's mathematics. Many of us can still remember mathematics. 6.81 was, the observed value was 5.95, 5.46, and 3.37. And if you multiply these up, this is 21 or 27. That's much higher than the value we saw. And if we look at those values for inhalant allergens in patients with eosinophilic esophagitis, we see no significant increase in the value with serial dilution. That is, serial dilution gives us an accurate answer. It supports the value seen with the undiluted. But with the foods, we're seeing values going up, in some cases quite dramatically. That's as if there is really a much larger quantity here of IgE to milk than we estimated based on the undiluted value. And if, as with the wheat, we're not identifying any components, I think it's really possible that these patients are making significant IgE to a component which has not been resolved yet. That is, that the assay for component is giving us a very useful negative. That is, the negative is saying, wait a minute, we've not yet identified the protein to which they're allergic. And I think in EOE, we need to know how they get sensitized. If it was going through the skin, like peanut, we ought to see much higher titers. The gut is a very poor route for making IgE, and that may be the correct answer, and it may be local in the esophagus, but we need to understand it. With that, I'd like to conclude and say RH1, H2, 6 are strongly associated with reaction. RH8 cross-reacts with BETV1 group and is associated with oral allergy syndrome. That we're all getting used to. Alpha-gal specific IgE induced by tick bites is strongly associated with delayed or midnight anaphylaxis. Do you prefer midnight or late night? Or has someone got a better what? Midnight. Midnight, a vote? Unanimous? Done. But it may be badly underrepresented in the beef and pork assays. Patients with EOE often have IgE antibodies to wheat or cow's milk allergens, but dilution studies suggest the relevant proteins may be a minor component. I think the thing that is really ready for prime time is CAT, that we really need to know in situations where it's not obvious what's happening, you need to know whether it's FeLD1, alpha-gal, or FeLD2. The FeLD2 cases were very confusing until we realized what they were. And with that, I'd like to thank many of my colleagues, but particularly Scott Commins, Elizabeth Irwin, and Lisa Workman, Haley James, who have done a lot of the work. Thank you.